You've seen our research on social media. Now, join us as we dive deeper into the public health topics of our time, featuring new studies and findings generated by our faculty and researchers committed to advancing health equity. From the Department of Population and Public Health Sciences at Keck School of Medicine of USC, this is Preventive Pros, the podcast.
So hi, I'm Rachel Carmen Ceasar. I'm assistant professor in the Population and Public Health Sciences Department. And I'm also a qualitative research consultant in the biostats group that sits in the Clinical and Translational Science Institute here at USC. Our research lab is called the Maternal Cannabis Lab. We do qualitative and quantitative mixed methods research that looks at people's experience of using cannabis during pregnancy, particularly, and what it looks like to be engaged in perinatal care during that period. We've been doing interviews and focus groups and surveys as well with providers, patients, and we're wrapping up a focus group study with cannabis professionals in that space. I originally wanted to study this when I started noticing when we did ethnography in the Bay Area with Dr. Kelly Knight, and we were looking at opioid use as policies were changing, as we were saying, okay, we gave opioids to people who are experiencing pain. Now we got to take that away. We're learning that opioids are really bad. And I understood those policy changes, but what does that look like on the ground? What does that look like in everyday people's life as you're saying, here's the substance, now you can't have it anymore. And cannabis was this kind of substance people were coming back to. At the time, it wasn't legal. And so wanting now that's been commercially legal, or recreationally legal, starting in California in 2018, January 2018, what are those effects? What does that impact look like for often understudied or populations that are not well studied or whose voices haven't been heard? So people of color, pregnant folks, women, what does cannabis look like? As everyone is very excited about legalization, decriminalization, what does that look like on the ground for people who are using cannabis during pregnancy and aren't necessarily getting the care they want? So I feel, with Dobbs, with looking at women's health and women's health rights, how does cannabis play a role or not kind of complicate women's relationship with the health system? Our work really looks at, cannabis is legal here in California. It's very socially accepted in many areas. It's very accessible to get. Yet when it comes to pregnancy and use of cannabis during that period, the rules change. Care can change. How providers and patients interact really can change. And so we wanted to track some of that. A lot of our interest is looking at women and gender and substance use and what that interaction looks like and what are those experiences and how health outcomes can vary because of that. And so we really wanted to kind of capture those experiences and really, so with patients, we've been really trying to understand, well, when you do disclose cannabis use during pregnancy, what happens? What does your care look like? How do providers approach you? What resources do they provide? And then in terms with providers, what we've been hearing is they rely on self-education. They take a kind of case-by-case approach. Well, if you're using cannabis but not meth, so sometimes they'll take a harm reduction approach. Sometimes they'll see cannabis and say, absolutely not, that you cannot use this during pregnancy. But people will continue to use. And so kind of trying to see what are those resources and approaches that providers use. The third thing we've heard from providers is that they'll try to avoid knowing kind of the mistrust of our health systems, particularly among Black, Indigenous, and people of color, knowing that historical mistrust and ongoing mistrust, that a lot of times, because cannabis is so connected to the criminal justice system, they'll want to avoid completely having that discussion with their patients because of the legal ramifications of it. And they rather say, I don't want to even put cannabis on the table because I'm afraid to lose this patient to care. I'm afraid to break that therapeutic relationship. And so what we see, providers are doing the best they can with child services kind of connected right there in that pipeline with our health system. But it's really kind of a missed opportunity and a disservice to patients, especially those who might be accessing care for the first time through pregnancy, through perinatal care, especially those who are being brought into the healthcare system during this time that maybe other times aren't accessing care, and those who are accessing care in safety net health settings as well. When we thought about reaching out to pregnant people who are using cannabis during pregnancy, we thought, oh, we're going to hear a lot about interesting use patterns, how much they're using, how little they're using, how that's changed across the different trimesters. But most people kind of said, I was smoking and I'm not smoking anymore. I'm using edibles or I'm using CBD. Everyone was trying to taper in some way. Everyone knew cannabis was not something they wanted to be used during pregnancy. That was a personal choice and a family choice. We just assumed some people will want to get high. Some people will continue their use of what it was like before. But I want to say almost everyone we talked to was like, this is not something I'm wanting to do right now, but it is filling some kind of mental health or physical gap that I'm not getting from the healthcare system, that I'm not getting from my providers. And so that was, I wouldn't say necessarily a surprising finding, but, when we talk to providers and patients together, we're hearing, cannabis as almost like this alternative form of therapy due to limited options in the health system. And so wanting to use cannabis to support, to not be throwing up 20 times a day, due to my hyperemesis, which is like severe vomiting and nausea during pregnancy, but now I can do it. I'm only throwing up 8 times a day, for example. Or, I had multiple sclerosis before my pregnancy and was using gabapentin to manage that, as well as medications for anxiety and depression. And now that I'm pregnant, I've had to learn how to taper that. I don't want to be using these pharmaceuticals during pregnancy. I also don't want to use cannabis, but I'm not given any other options for my pain. Or I don't feel like I'm getting options for my pain or guidance from my provider on pain management during pregnancy. And every time I try to schedule a therapy session, it's a student, and I'm constantly having, not having the adequate mental health resources available. And for a lot of people we talk to, cannabis is inexpensive, it's accessible, they can manage how much they're getting in a way that feels safer to them. And so really wanting to listen to that. And, you can tell people until you're blue in the face what the policy is. Do not use cannabis during pregnancy because we don't have enough research on what those effects might be for mom and baby. But in the meantime, we need to see people are using cannabis and they're using it to support their mom and baby, and trying to kind of understand what those gaps are in the research and the support as well. Especially with our pilot studies, what we're hearing is that people who use cannabis during pregnancy, one, they feel judged and threatened with punitive actions when they do disclose. So there is that fear there of the threat. And then we're also finding they are actually experiencing punitive action. So that's child services being involved. The threat of baby being taken away, from being separated from mom and family, and that actually is happening. And I think a lot of folks assume, we're in California, it's legal, we're here in Los Angeles, or, in NorCal, or, Central Valley, like everyone's kind of okay with cannabis. But when it comes to women's reproductive health, when it comes to women using cannabis, the rules change, the perceptions change, the blame changes. And so what I'm hoping with our research, what these small pilot studies are working toward, is to change policy, have this research be a way to kind of open up conversations with departments of public health, to get this research out there to community leaders as well, and to try to provide some education that is patient-based, that are coming from patients. There is actually a lot of research on cannabis, but it may not be getting to providers in a way that is productive, that does link it back up to people's lived experiences and the risks that they take when they do disclose and share that with their providers. I think with legalization, there is the excitement of like, this is a way to decriminalize cannabis. And that is a very good thing. This is a way to provide access to cannabis, make it affordable, collect taxes on it. And that's all really good. But I think kind of a consequence of that is that we're seeing, as there's more and more legalization, we're seeing increases in maternal health disparities, particularly for pregnant folks. And so I think legalization is opening that up, but we're seeing, I think, just even in the shadow of the Dobbs case and abortion, I feel there's a lot, and we're seeing this with our research too, just fears among women and their health and what they can and can't do during pregnancy and postpartum. And so sometimes, even though my research is about cannabis, and a lot of my other work is with collaborators here in our department on substance use, a lot of my work I feel is not about cannabis at all. And some of the fears of what we saw with, in quotation marks, the crack baby epidemic, I'm seeing a lot of those same conversations around cannabis use in women, these kind of bad moms or these kind of stereotypes, and not really kind of talking to that person and not really understanding, well, what is this experience of not being able to get the care you need for yourself and your family, and how other things can come support that in a way that feels empowering or manageable for that family. In terms of next steps, I'm really interested in seeing like the trajectory of what doesn't usually get screened in a urine test, and a urine toxicology test is alcohol, tobacco. And so what are those conversations around not just cannabis use, which is kind of like the hot topic, but what does it look like between tobacco, alcohol, cannabis, e-cigarettes? Like, what are those use trajectories look like, not just across pregnancy, but across women's health and life experiences? And so I'm really interested in kind of areas where cannabis, again, where it's not about cannabis at all, but just like trying to manage women's care and health. And so looking at a grant that we just put in for American Cancer Society of like looking at e-cigarettes, tobacco, cigarettes, and cannabis, and seeing if like maybe cannabis here is a harm reduction tool, because we do know smoking cigarettes as well as alcohol use during pregnancy is really bad. And that's been a very clear public health message. So is cannabis being perceived as and used as kind of the safer option? I'm not sure yet. The other study that we're really interested in getting off the ground that we submitted some grants for is looking at hyperemesis, which I mentioned earlier is like very severe vomiting and nausea to the point you could lose. The extreme cases, like you lose the baby or even death for the mother. That's like the extreme case. And some folks are finding cannabis as a way to help with that. And so trying to see, is cannabis in this case of people who have hyperemesis, is this a way to self-medicate untreated hyperemesis or hyperemesis that wasn't fully like supported, or, the medicine wasn't helping, or the provider didn't provide the right medication? Is there variations in care? Or people who have hyperemesis not getting the care they need, and they're finding cannabis as a way to self-medicate?
Preventive Pros, the podcast, is produced by the Department of Population and Public Health Sciences at Keck School of Medicine of USC. To learn more about any of our episodes, or to subscribe to our monthly Preventive Dose newsletter featuring the latest in public health research and news, visit pphs.usc.edu/podcast. Thank you for listening.